So let's start out with this term peak week. Please, for our listeners, tell us what that means with regard to the patients and their asthma, and what are some important messages for parents and children about trying to maintain stability in their asthma control during this time of the year.
Well, first of all, I have to say that as an allergist and immunologist, I love the season for so many reasons. One is getting kids asthma action plans. This is the time they come to me and they say, okay, Dr. Mora, give me an updated asthma action plan. It's time to, one, review medications. It's two, make sure that their inhalers are up to date and they're not expired. Three, that they're using them correctly. Four, that if they need a spacer, they're using a spacer as well, too. And then also reminding them and figuring out what the triggers, any new triggers for their asthma. Has something thrown it out of control? A new little cat at home, a new little dog at home. The seasonal allergies, definitely ragweed and weeds. The pollen season in the spring has been really hard hit, and a lot of asthma has been out of control. So it allows me to have these conversations. And then last but not least, I also have to say, this is my time to also remind them, you're going to have to come back in the fall for a flu shot. Let's update your actual vaccinations as well, too. If you're not up to date, make sure you get your physical in with your pediatrician. All your vaccinations are up to date. And your COVID-19 vaccine, which will hopefully be out this early fall. So that way we get everyone protected and updated. And these are the conversations. Now, you also asked about peak week. Do you want to take it, Christy?
Yeah, sure. So when we think about asthma peak week in the fall around the back to school season, it refers to a big uptick in asthma exacerbations. When we say asthma exacerbations, we mean, a period of flare up. It's typically a period often of at least a few days, maybe longer, where people are experiencing more difficulty with their asthma. So coughing, wheezing, chest tightness, shortness of breath. They need their rescue inhaler more often. And we do often see this, very early in the back to school period. And one of the big drivers of this is, kids are getting back together in a closed setting, and there are viruses that get spread around. We see this every year. And parents often tell me, oh, they do great in summer, then they go back to school and they get sick. I would say, in addition to that, Dr. Mora has already nicely outlined that many of our allergens are seasonal. So for some patients, depending what they're allergic to, certain pollens, for example, I think I'm a pulmonologist, not an allergist, but I think of things like ragweed happening in that very late summer, early fall period. That can coincide with this reentry to school, getting a virus. And if someone's having multiple triggers at once, meaning the virus is flaring the asthma and the allergies are affecting that person, it can just be a recipe for an asthma episode. And the best thing to do to be prepared for that, some of the viruses in schools, that's just a reality. It's just something that happens. And so I think it's very important that we do what we can to make sure people are on a good preventative asthma regimen. Sometimes people are prescribed asthma controller medications, preventative medications, and they may or may not be taking them as often during the summer. But it's important to either make sure you're taking them as prescribed or touch base with your physician or your healthcare provider to make sure you're on the right plan as you go into that situation. Because really, our goal is for someone to be on a good asthma plan so that when you ideally you get a cold or you encounter your allergen, and it's not leading into a spiraling effect of severe asthma flare-ups. So, we can preempt some of this and just remember that that's a vulnerable time of year. It's a good time to go into it proactively, being on the right regimen and being on top of the meds.
Right. I want to go back to Dr. Mora mentioned the action plan. I'm curious as to how much you interact with school nurses, for example, who I suspect should have a copy of that asthma action plan for many of their students. Is that something you run into as a physician, or is that mainly the parents that deal with that?
Well, usually what we do is we give the parent an asthma action plan, and they also submit it to the school along with an albuterol inhaler so that the kids have it. And a lot of the times, especially for kids who have severe asthma, or maybe are having a little more trouble, the nurse will actually call the office and say, hey, Dr. Mora, I'm seeing this patient and they're having a little more trouble with their breathing. And so I wanted to touch base and see if the action plan that you put through is still valid, or do you want me to make any changes? Which I love the communication at that point as well, too, because I think it shows that she cares, that we're all touching points to really care for this child. And I think it's important to have that open communication with the parents, with the schools as well, too. And I think, it's part of also being involved with the community, which I think is important as well, too, and talking to the Chicago public school system, like here in Chicago, which I am, or anywhere that you are as well.
And do you find if there's, I think some rules are different about school districts and localities as far as access to rescue inhalers, as far as the patients being able to actually have them, or they have to go through their school nurses? Do you see much difference there?
What I usually have is to write a note so that the student can self-care. So if the student doesn't have a note that they can self-carry and self-administer, then the nurse has to administer the actual medication. But if they're old enough and they know their triggers, then I allow them to carry and I allow them to actually administer their own medication.
Right.
Yeah, I can speak to that too. Ideally, everybody with asthma, and certainly any patient I'm meeting or taking care of, they do need their own, and this is in Maryland, and it's pretty common across the country. They need an official form that's filled out, that's standardized, explaining their rescue medication, which is usually albuterol in the school setting. And they also need an asthma action plan for the schools to be able to give albuterol. So not only do they need paperwork, but the patient must bring the medication and usually a spacer of their own and leave that for the school. And there's rules about how it's done. It needs to be done every year at the beginning of the year. Need to make sure the medication's not expired and that the paperwork's up to date. And that's very important on the individual level. Dr. Mora and I are both practicing in states, Illinois and Maryland, that have laws that also allow an additional safety mechanism, which we call stock albuterol. And what that means is, and in Maryland, this just happened. So our law went into effect a couple weeks ago on July 1st. So it hasn't really been put into practice yet. But in Illinois, it's been there for longer. But basically, it's an additional safety mechanism where we're asking schools to have a mechanism, to have albuterol on hand for respiratory emergency. That's meant to fill the gap for kids who aren't able to turn in their medication, or maybe they don't realize they have asthma and they have their first bad episode at school. It's not meant to replace. So, for example, here in Maryland, now that we have this law, I'm not changing what I do. We don't say, oh, the school has it, you're good, because everybody's asthma plan is individualized, and we want to make sure that we do the best we can. So when we talk about working with schools, I've worked with nurses and schools one-on-one, like Dr. Mora was talking about, and also on a larger level in terms of advocacy and policy making. And we'd really like to see, me personally and a lot of my colleagues, would like to see those kind of laws and policies occur in all 50 states. I think we're up to about 20 now, but all 50 states have stock epinephrine for food allergies. So we're just trying to bring up stock albuterol to match that. So that's also related, but doesn't replace, individual patient level care and documents we do.
And that's certainly an advocacy aspect of what the American Lung Association tries to do across the country as well.
Yeah, they do a lot in Maryland, so much.